Fear-free, everyone is here because you want to learn more about it. But I'm sure you're thinking, what do we do when we're busy, we're short-staffed, that super high FAS dog or cat comes in that we're all kind of scared of, our team isn't confident, now what? They won't eat treats, now what? So that's what we're here to hope to help answer. So I'm Dr. Megan, like I said earlier, and this is Jessica. We are both fear-free certified elite professionals, and we co-own Layton Creek Animal Hospital, which is a fear-free certified practice. And we see a lot of high FAS patients. We market to them. We want them to come, and we want to help you help your high FAS patients. Like Jessica said, we want to collaborate with you. We want to help educate you guys, the community, anyone who will listen. So thank you.
Or we can walk in a room and get to listen.
Or we can drink here with steak, if we're being honest. Which I haven't seen a steak yet, so gotcha. Thank you so much, Dr. Becker. Thank you so much, Mikkel, for being such our huge supporters and collaborating with us. We love you guys. We love your mission. It's our mission too. Thank you. Thank you. Everything Dr. Becker said is awesome. You want to start your journey with fear-free, do it. Or continue your journey with fear-free. We are going to talk about, like we said, just the high FAS patients, because it's pretty straightforward to implement fear-free when they're FAS 0 to 2. Mm-hmm. They're eating, even if they're nervous, like even if you're getting up to kind of a high 2, they will usually eat, they want to interact with you, you can overcome their nerves. That's pretty straightforward. We are not really going to talk about that. We are going to talk about your high FAS patients that need different techniques, how to accommodate them in ways that's safe for you and as fear-free as possible for them. So we did collaborate with our own internal fear-free team, most of which is here tonight, to cover all of the angles of the clinic when you see these pets, because it's not just the doctor who's going to have to help them, it's not just the LVTs, it's the assistants who are doing nail trims and checking in your appointments, the LVTs who see their own appointments, your CCRs who talk to them on the phone, your hospital manager who gets these questions, like what do I do? Where do I book them? How do I set this up? I mean, it's everybody has to play a role. Everybody has to be on board. Everybody has a lot to offer, but alas, you're stuck with us giving the presentation. If you have questions for them, ask them after. We want to give you ideas and strategies that you can use tomorrow with that patient that you're probably already thinking about, like, oh my God, what do I do with Fluffy? That cat is crazy. No, he's not, he's terrified.
Okay, so
Who's Fluffy?
this baby.
Yeah,
The couple things that we'd like to talk about first is, and these things really helped us, is your mindset, we need to change it, and your approach, we need to change it. And I'll elaborate on those a little bit. Next slide, please. I'm gonna be like Dr. Becker. Next slide.
Next slide.
So in changing your mindset, you want to think about how we think about our patients. They're mean, they're bad, they're aggressive. We got to change that. We want to think about how we talk to our patients, how we talk about them. Oh, Dr. Megan, I have Fluffy. Fluffy's a pain in the ass. We have to change that. We did it. I used to work with Carrie at Lincoln Heights, and we did it. Right? We've all done it. Some of us probably still do it. Some of us slip and accidentally do it, or we refer to our own pets that way, right? Learn where to put appropriate notes in medical records so that you can find them. There's lots of different softwares. We use Cornerstone. You can put notes. We currently use EasyVet. We actually made our own emotional medical record section. Avamark has a note section. Every Shepherd, if anyone uses Shepherd, they actually integrate with Fear-Free now, I believe. So you can track that. You want to be thinking about, are there concurrent problems? We have had patients come to us from local clinics, very, 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 very high FAS, and the dogs were in pain. And so we were able to help them that way as well. It's very serious that there are some concurrent things happening. A big change of mindset for myself was letting owners help restrain, because, right, it's a liability. They can't, if they get bit, they can sue us. And I've been a hospital manager now for like 15 years, and that's like, nope, can't, absolutely cannot. So that was a big, almost paradigm change for me to be like, where's the owner? They need to come help. And then deciding where you guys are gonna draw your line. It's gonna be different for every clinic. but draw it. If you guys say, you know what, we're gonna focus on FAS 3, 4, and 5 strictly for team safety, great, that's your line, stick to it every single time. If you're going to go all in with fear-free, great, stick to it every single time. As much as we would love everyone to be fear-free all the time, it doesn't have to be all or nothing. Okay, next slide.
Okay.
And then as far as your approach, we want to think about cats and their carriers. Asking clients to bring their cats in a soft carrier is awesome. Having carriers that come apart, making sure that they're clean and nice and not stored away somewhere, ideally maybe left out, help them acclimate. Everyone's lobby and clinic is set up differently. Do what you can with your space. Fear-free doesn't require anything. Before we moved into our new building, we were in a teeny tiny space, and we did the best we could with our space, and they still certified us as a practice. Just do what you can within your space. Even Dr. Becker said, if you don't have a dog and cat separate room, change the room each time someone different goes into that room. If you can designate one room as a cat room, that's a bonus, but it doesn't have to be. Let your clients wait in the car. COVID did us a favor in that way because all of our clients were used to waiting in the car, and we didn't change that. So everybody waits in the car, all of our dogs wait in the car. Cats, we bring them in, but very specifically to wait and then go in their room to acclimate. You have to have a plan for every single one of these patients every single time, because they're all different. Plan every single time. Even if it's the same pet coming in, you need to make a new plan each time because it can be different.
Now we get to talk about trigger stacking. This is a concept that is very close to my heart as someone with anxiety, which all of us in the vet industry probably have, let's be honest. So the academic kind of definition is when lots of little stressful events add up until one of those events triggers a huge reaction that seems disproportionate to what actually happened, but it's because of everything that happened before it. You can think of it, my favorite way to think of it is like a balloon. You add a little bit of air, 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 until finally one of those little bits of air pops a balloon. Some animals start with pretty much an empty balloon. These are your happy golden retrievers. You can probably add a lot of air before you're going to get that reaction. Some of your dogs come in with it already basically ready to pop. There are going to be triggers, even the most fear-free certified practice, even the pinnacles of fear-free cannot completely mitigate. So you want to control the ones that you can. So think about our dogs. We put the dog in the car, he gets car sick. We drive by construction workers, they're big scary men in hats and vests, I don't like it. Then they get in the parking lot, they see dogs in the parking lot. They don't like that. Then they go in the lobby, there's barking in the lobby. Okay, then they get dragged onto the scale. Then they get in the exam room, they can still hear those dogs barking, it's still loud. Then the assistant comes in and out, forgets something, has to come in and out again. Then the doctor comes in real fast, sits down facing the dog, reaches for him with the stethoscope, and they get bit. And they think, the stethoscope was that upsetting? Yeah, that time it was. Or cats, that carrier that Jessica talked about, they pulled it out of the garage, dusted off as many spiders as they could, shoved the cat in it. They get in the car, cats traditionally love the car, right? Then on the way in, the kid's walking them like, swinging the thing like this, cat's like, what the? Then the owner puts him on the floor, all those barking dogs, remember? One of them rushes up and sticks his nose in the cat's face, then he gets pulled out by the scruff, dumped on a cold table, the assistant goes to take the TPR, what happens? Then they're like, why is this cat such a jerk? So think about what can we alleviate of those? You can have your dog on car sickness meds. You can wait in the car with the dog. Go straight into an exam room. The assistant can choose not to take the TPR today. Oh, he looks nervous. I'll just let the doctor do it all during their exam. The doctor can come and sit sideways and take a deep breath and talk to the owner for a minute while the dog sniffs them, so that when you do the thing you have to do, the stethoscope, the dog's like, oh, this is okay, maybe. Same thing with cats. That carrier Jessica was talking about, get a nice comfortable one, keep it in the house, don't let it get covered in dirt. Walk in carrying it like a baby you actually care about. Keep them away from dogs, put a towel over it, put them straight in the exam room and give them 10 minutes to warm up. It'll make a huge difference. My second favorite topic, social pressure. Now we're in the exam room. We've gotten them in there. We've mitigated as many triggers as we can. But one way we cause them stress, this was a huge learning moment for us, that we are putting pressure on them. That's one day, like a wake-up call, we realized we were doing this. Dogs, yeah, like a Kayla wake-up call. Kayla was like, hey, what you doing? I'm like, what? Oh, yeah, we shouldn't be doing that. That's okay. You know what? We are very open about our entire journey to how we got where we are and are willing to learn new things every single day. Dogs, as we all know, are socially motivated pack animals. So they are more affected by social cues, like calling them over. Come on, Fluffy, come on, Fluffy, it's okay, come on, Fluffy, it's okay, come on. They know what you want, but they don't want to do it. And that creates conflict. I know what that means, but oh my God, I'm so scared, I don't want to go over there. Or they push through and do it, and then they're stuck in a tractor beam, staring at you, not able to disengage because it's too scary to turn around from this weird lady, and then you get bit. So another way, this is a newer one for us, is realizing those dogs that love treats too much, that it is no longer classical conditioning because they are pushing through their stress to eat. Their ability to say no is completely overridden. So they're not gonna give you the stress signals because they're so excited. Think about your labs, right? They're so focused on the food that that's all they care about, but that internal stress is still mounting. They're kind of doing two things at once there until something will push through that love for the food and they will escalate seemingly all at once. And you're like, why did he bite out of nowhere? He was eating the cheese. You know, you're like, oh, you could cut this lab's leg off from all this cheese he likes. That's maybe not great. That's one of the few times that you might want to use a reward instead of a food distraction. So what do you do for both of those situations are games. Kayla's gonna talk a lot more about the games during the panel. She has taught us some great games to be able to play with them that will allow you to use food, but not overwhelm them and not call them to you. One is tossing a treat away from you to see if they want to come back and keep engaging with you. And another is how to use food as a reward in those situations. It's not just one treat at the end. There's a way to do that correctly if they are too food motivated. You've also all seen those dogs, right, that are in the exam room, pacing and panting, on the bench, off the bench, under the chair, out of the chair, and it makes me anxious just to watch them. Everybody who's on a fear-free journey, and if you say this wasn't you, I think you might be lying, has gone through a phase that thinks fear-free means no restraint, right? Fear-free means we just sit down and magically this dog will come to us and be fine. Or hold the collar. That was a phase that we went through for a little while. We're just gonna hold the collar, it'll be fine. We're just trying to get crunk. So fear-free says it themselves. Gentle restraint, gentle control is more calming than this constant pacing and spiraling up. If they'll come to you and interact on their own, awesome, do that. But if not, for dogs, I got this straight from Fear-Free, 3 tries of 3 seconds of gentle restraint each try. And if they kind of relax into it, great. Then I have the owner come and feed and distract and still doing all those things, but you can definitely restrain them. Cats, not pack animals. They don't care if you call them. They come, they don't come, they don't care. It doesn't stress them out. They're like, yeah, no thanks. See you on the other side. They could not care less. How we stress them out is environmental. They are so focused on and motivated and territorial by their environment that that's their big, so you're already socially pressuring them just by having them out of their house. Then they're dragged out of the carrier a lot. They don't like that, because now we love the carrier, not the rubber. They're not given time to acclimate to their new environment. They will usually warm up to the exam room all the way up through FIS 3, I'd say. I even had a 5 today who was like fine in the exam room until I came in, but the room was fine because he had time to explore. Give them like 10 minutes just to walk around and rub their cheeks on stuff, breathe in the feel away. It helps a lot. Not having a hiding place, that hiding place could be their own carrier too. It's not anything you necessarily have to provide. And just scent disruption. Using feel away really helps with that, or bringing a towel from home. You can restrain cats too, but it's 2 tries of 2 seconds per try. because their fuse is a little bit shorter before they escalate.
Hey, Dr. Megan.
Hey, Marty.
What I love is she had a cat, I hope I tell this right, that was a stressed cat, and it went through the experience of their practice, and then the owner went home and didn't realize he didn't have their cat, right? And then the cat was asleep at the clinic, right? That was when they were filming where she couldn't find the cat, and wasn't it one of the carriers? Am I on something?
Do you remember?
Just say yes.
How many
Megan,
drinks
yes,
have you had,
yes,
Mark?
remember.
Yeah, I'm kidding.
Yeah.
I thought it was in one of those sleeping pods, and maybe I heard the story wrong.
Do you remember that, Val? No. Val remembers everything. They're a memory keeper.
Somebody lie.
Yes,
absolutely.
Yeah.
Oh, yeah, I was there.
Yeah.
Oh,
Yeah.
Elizabeth
Yeah.
remembers.
Okay.
Okay.
Let me reel that one back.
Yeah, okay. So, still trying to change our approach, let's set ourselves up for success. So, track their FAS in your software. Any place you can think, find it. Again, we like EasyVet. They actually have this demeanor section. It does not integrate with Fear Free, but it has a demeanor section. And so, when we moved into our new building, we were able to search like all our FAS 5s, all our FAS 4s, and we sent them different things for different reasons, but you can search it that way. But it is very obvious to those looking up those patients. Cornerstone, the notes pop up. Avonmark is probably similar. There's notes that pop up. We use a different color for our high FAS patients. So they are back to back, which is not ideal, but sometimes it happens. These two peach ones are high FAS. So when you're looking at the schedule, you know they're high FAS, you can make a plan.
It is a dog and a cat though, so that was okay.
Yeah.
Different size of hospital.
Different sides of the hospital.
Yeah.
Yeah.
Different rooms.
So that helps when you're making your plan. And when we make our plan, we have to have the right team members. These patients are very stressed. The team members can get very stressed. The owners can be very stressed. We have to find the right team members. So we have really tried to make it a standard in our clinic. What do you got, Courtney?
I was just thinking about Elizabeth.
We got a story. Not to get your feelings hurt. I'm sorry, Elizabeth, but Franklin is a high FAS cat, and we don't think you're the right LVT, and Elizabeth's like, I agree.
That's fine.
It's fine.
My own cats don't like my pheromones. It's a real thing. I don't know.
But we really try to stress, please no hurt feelings. Please, please, please no hurt feelings. It is all about the pet and getting them the best experience possible. I don't know how everyone's rooms are set up, but for these patients, have your tools and your supplies ready to go. If you don't keep them in the room, you should for these patients. Have them there, take them with you so you're not in and out of the room and you have everything that you need. Stay in the exam room. I know that a lot of clinics are still taking pets to the back. These dogs and cats are not candidates to go back there. If the owners don't want to watch, or the owner is the cause of the stress, because that is true as well, they need to step out. They need to go sit in the lobby or somewhere else except there with their pet. And again, this comes in with, where are you going to draw your line? And if we have this pet that doesn't do well with mom and dad, our line is you have to step out. Like, we have a very clear line of what we're going to do and when we're going to send patients home or clients to other clinics.
What do you tell them to get them to step out?
Of the exam room. Elizabeth, do you want to talk about that? Because you do that a lot.
Yeah, so I do that quite a bit actually. You have mom in the room and, oh, he's just really nervous. And, it's okay, Fluffy, it's okay. I will say, Mom, I think, Fluffy, as you know, is very nervous. Why don't we try seeing how he does if you step outside of the exam room? Just step in the hallway. If he seems to be doing better, great. If not, I can have you step back in. And generally speaking, if you're verbalizing and if you're verbalizing what signs the patient is having, they're panting, they're avoiding eye contact, they're growling, any of those things, even less obvious ones, if you point those out to the clients, they're generally pretty perceptive of saying, oh, well, yeah, let's try that out. Because I'm sure they don't want their pet to feel that anxiety and stress.
Especially once they start to understand what you're doing, right? The first couple might be like, I can't get that client to leave that exam room, right? It's gonna happen. Or you're like, I don't know what to do, or she's crying, or oh my God, and then maybe the best choice is to maybe take it into a different exam room.
By the way, you must be in community theater, that was good. A couple other things you can do, a lot of times we saw pets during COVID without the mom or dad there, and you could say that we noticed the pet did better without you during
Yep.
COVID. Another thing, I learned with somebody else, is to say, he or she is so protective of you.
Yes.
And that's
Yes.
another way it's kind of palatable for people.
Yeah.
Like that.
They like that.
Yeah.
Right.
And then it's like, damn right. You know?
Yeah.
Yeah.
And then it is also very important that if, as a team member, you're scared when you check that patient in or when you see that patient, that you say something. Because that's when someone's going to get bit. If you go in there and you're very, very nervous and you're trying to check him in, he's just staring at you, feeding off of you, and someone's going to get hurt. So it's also very important that when our team comes to Dr. Megan and says, I don't know why, but this pet makes me very, very nervous. Great, Kayla, Elizabeth, can you guys come and help me? You might not have enough team members for that, but really try to make that a priority if someone is actually scared of them, that you don't make them go in there. Very, very important. And then sometimes we take a team member and they're not the right team member and we get a different team member. Just whatever we need to do to make sure the pet has a good experience. Because again, through trial and error, which we'll talk about as we go through, we're trying to get ahead of it and get the right team member in the beginning before the patient gets pushed too far and has to go home.
I was just gonna make a comment on that. When you are in a situation with an owner and that dog in the room, a lot of times the things that I will do is if I notice that dog is really stressed out, sometimes just asking the owner and saying, boy, I noticed that he's so worried and stressed. What has helped in the past, or what do you think would be good in this situation? Do you think he is better with you, or do you think he is better away from you?
Yeah.
And the owners are a lot of times very like, oh yes, like this is the best thing. If you take him away, he does better away from you. So just kind of bringing a question up to the owner, how can we make this visit go better? They can help them with that.
And they'll really start to think about that the more you guys are talking about it with them.
Our journey. Right, we wish we were not bloomed into this world, all of us as fear-free professionals. We've been through our share of learning. One of them was unknowingly causing stress by pushing them too far in the name of fear-free. Like, okay, now I'm gonna try this. Oh, nope, that didn't work. Okay, now I'm gonna try this one on. Oh, that didn't work. Like, okay, okay, let's get a different team member. And it, not like laying on him, pushing him too far. And the dog is like, what are you doing? I don't know what's happening, but I don't want any part of this. Then they had to leave and try again another day, which is fine, but we don't want to be the reason that has to happen. Another one was an absolutely god-awful amount, this is on me, of fiddling around with drug doses. Like, oh, let's just do a little bit more. Oh, let's start at a low dose. Oh, they scare the heck out of you about drugs in school, in my humble opinion. And now I'm like, okay, well, and poor Jessica would be like, do you think he needs a little more? I'm like, no. And then like, okay, well now he needs a little more, now he needs a little more, now he needs a little more. Oh, it turns out you were right. And now he's overridden each step of the way, and he's like, yeah, I gotta go home. I gotta go home. Like, oh, sorry.
Or they come on trazodone, it's not enough.
Yeah.
Okay, we send them home. They come back on a little bit more trazodone, it's not enough, we send them home. Carrie, we went through this too.
Yeah.
Okay, now we're gonna maybe add a little bit more, we're gonna try one more time. And we have like 4 or 5 times.
Oh, no. So we do now have a standard of, for the ones we send home, they can try one thing, then we send them.
Yep.
Like, okay, we're not gonna do that anymore. If your PVPs, because now we have very strong PVP protocols that we'll talk about later, if those didn't work, it's not going to. It's not going to, it's time to sedate. So we have, again, we'll talk about this more at each level. Fear-free, like Dr. Marty was saying, has really awesome doses and protocols and things available for you to use if you're fear-free certified. We took all that and chose basically one for each level to start, so that there's a standard for our patients of where they start, and then it can be personalized from there. But like we said earlier, lots of different team members are working with these patients, so it's very easy for Val to come to me and say, gosh, me and this other assistant were doing this nail trim on this cat and it turned into FAS4. Like, great, here's the FAS4 protocol. I don't even need to be involved.
But what was our journey?
What was our journey? We were scared to properly score them. That has definitely been a barrier. Because in your mind, right, like Jessica talked about changing your mindset. In your mind, if FAS 5 still means he's bad, he's an asshole,
It's aggressive.
caution,
Yeah.
is aggressive, will bite, then you're not gonna wanna say they're FAS 5. If FAS 5 means, well, he came in and he had his muzzle on and we did muzzle punch, but we covered with a towel and we're able to sedate, it's a lot easier to mark them as FAS 5. As a quick
I
side
had a
note,
growing year that year.
that was a big year. There was a time that we were trying to sedate outside, and I got so frustrated I threw all my instruments in the bushes. It's fine. We learned from it. She got her care elsewhere.
The scoring got better.
It got better. It's fine. Everything was fine. It was porcupine quills. It was okay. As a side note, that we can talk about this at a different CE if you bring us back. Aggression at our clinic is a diagnosis. It's going to be 1 to 5% of your patients. These dogs who are scared, cats too, lunging at you, maybe even biting at you, 99% of the time are just fearful and reactive. Actual, true aggression, I'm instigating it, I don't have triggers, or you can't, send normal social signals and I'll back down, is very, very, very rare. So you're not gonna hear us use that word. We consider them reactive. Again, true aggression, rare, that's a conversation for another time, but.
Okay. So then, of course, we had to draw a line. And basically, at this point, our line is not proceeding equals sedation or the client finds a new clinic. I mean, that's very bold and direct, I get that, and there's some caveats in there, but we sedate or they find a different clinic. And we try our best to tell them where to go that maybe won't make them sedate, but we don't actually know that information, we just give them some suggestions. What we do use, so not so secret weapons is clients fill out the PVQs, which is the pre-visit questionnaire, so that they give us, and they're getting used to these, so we're getting some good ones. The information is getting better on these. The emotional medical records, so this is just an example of one out of EasyVet. So we do one on the phone when the front desk talks with them to find out what stresses them out and what tips we can give them. We do one at check-in with the assistant, and then the doctor adds stuff there because, as everyone knows, things change when the doctor goes in the exam room. For our current patients, we know them, and so even when we have a plan and it doesn't go well, we still have a plan because we're not pushing them too far now. So when the plan doesn't go as we hope, we can still get them seen. For new patients, because as Dr. Becker said, we can't give them gabapentin or trazodone or any of these wonderful things that we have. Don't always go as planned, but we used to try to help them the best we could initially, and now we sedate them and we try again, and then we do the pre-visits next time. Today we're just going to sedate. Today we're going to sedate. Today we're going to sedate. We're not going to do anything like that. It just that's our line. So we need to sedate, and then but we still get the PVQ. We're still assessing them, and a lot of times it ends up either not today or a visual exam. Do a lot of visual exams. Send them with the PVPs, and then have them come back the next week or at least like 72 hours later to see them.
One line that always hits in the exam room, I've never had this fail ever, so I will gift it to all of you tonight, is you only get one chance to make a first impression. And the clients are like, oh, you're right. You're right. Well, can we just, nope, we just get this one chance. He will never be a new patient here again.
I like yours better than mine.
What's yours?
Mine I stole from a really good Fear-Free veterinary. She says, I'm not gonna sacrifice your pet's long-term emotional well-being for the convenience of getting this done today.
Yes.
That's good. Yeah, yours is shorter.
I like yours better.
Mine's shorter. It's a little snappier.
Yeah.
Yeah.
More fun, like me.
Well, and if you remodel or move or build a new clinic, that's your time to do it, because we took full advantage of that moving into the new clinic that we built. We're not poisoning these doors, this room, this, that, treatment, anything.
What do our shirts say, Val?
New building, new
New
beginning.
building, new beginnings. I have to think about it.
Oh no.
So when you're on your journey, it's really important to decide where's your line. And wherever that is, again, whether it's just about safety, just about the pets, about all of it, pick your line and stay there. Okay, so we are going to now get into the even better stuff.
Yeah.
The FAS 3 to 5 dogs. So there are specific identifiers for each level, and I did put printouts on each table. We have these hanging up. We have other sort of cutesy ones off of Etsy too that the clients really like I think we're that today. Because the clients have gotten used to it, so they pick, and like the kids, oh, what do you think about that one? So they really like them. There's just kind of a snapshot of what's on the table. However, each patient is different, so you have to treat them that way. Each patient's different, each day is different. Again, if you don't want to be all in fear-free, cover your ears, Dr. Becker, anything is better than nothing. Picking some of these things is gonna help some of your patients, and that is all that even fear-free is asking at this point. Just any changes you can make is amazing. Fear-free has lots of resources that are available when you are certified. We printed those off, and then, like Dr. Becker said, we'll email you their drug protocols. And then we also have our pre-visit drug protocols on the table as well for you guys to take. There's gonna be a lot of overlap between them, between 3, 4, and 5, just in terms of barriers and safety and things like that. But as we get to 5, they get more important. And this is where properly scoring them is very, very important, because when we, in 2021, said, well, like a 2, and then you come back to next year and you're a 4, and it's not because anything about you changed, it's because, excuse me, we did not properly score you. Okay, so we're going to talk about how to score them, barriers to care, team safety, and what our PVP protocols are.
Okay. Ready for 3?
Yep.
All right. FAS 3, the middle zone. They mostly will present on the outset frozen. They might eat, but they are unlikely to, at least at first, until they warm up, play any of the treat games with you. You can maybe get them there, but usually they were just frozen. If you put pressure on them, the first thing they try to do is turn away and send you all those appeasing signals that we saw in some of Dr. Marty's slides. They really just do not interact. They do not want to interact, because they have to. With gentle handling, with PVPs, with everything we've learned, we can keep them from escalating more easily than the other 2 levels that we're gonna talk about in a minute. One thing, you can please empower your assistants, please empower yourselves to choose not to TPR. I hear that multiple times a day. You know what, I just went ahead and didn't do his TPR because he was a little bit scared, so we're just gonna let you do that while you're listening to the heart. Great, perfect, I will do that. Get the touch thermometers if you don't have them, much less stressful than the rectal temperature, as a side note. Doctors or LVTs or whoever is driving the appointments, you want to focus on de-escalation, because these are the ones that you can de-escalate. Sometimes even without drugs, try to sit down for a minute, let them warm up, try to play some of the treat games that Kayla's gonna talk about. If that's successful, if they're kind of warming up and starting to eat, you can work on desensitizing them to tools and things before you do it. We have a lot of herding dogs who end up being a 3 who then will play with you because they like to work so much. You have to get the owner involved. With these ones, again, we can talk them down, we can get the owner involved. They need to be in control of the head. They need to pet the head, they need to be giving treats, they need to be keeping you from getting bit that way. If they won't take food, have the owners block the vision. Sometimes they can have the head facing them, and you can come up from behind and get what you need to do done. We're going to do some counter conditioning, providing some different sensations in other areas of the body while we laugh it up, yum it up, play talk. Some counter sensations, if you will, so that they're not so hyper-focused on like Dr. Murray said, the needle. If they can't see it coming, they're not going to care.
And we do have a good video at the end.
Of this one,
Just, I think he's higher FAS,
Yeah.
but yes.
somewhere we have some visual aids. You can also have the owner hold the stethoscope. I mean, really just get them to all think outside the box. They can hold the stethoscope on the patient. If you get hearing aids like I have, they can have the stethoscope all the way at the other end of the room. Follow me for more life tips. They were really expensive though.
Okay, some barriers for FAS 3. We can accidentally escalate them to a 4 or 5 very easily if you push them with our trigger stacking and our social pressures. So if we're not trying to alleviate some of those, or if we're unfamiliar with the term social pressure, we're going to escalate those patients that otherwise probably could have been neutral or de-escalated. Again, not properly scoring them, that is going to be a barrier for every single one of you guys. It just happened. Or you go on the other spectrum of it and you score them too high. Both possibilities are very real. A barrier also, especially with the 3s, is, oh, he's fine, the owner. Oh, he's fine, no, he's fine. Look at him, he's just sitting here, he's fine. He's frozen and he's terrified. And it's really important to be able to educate the clients with, you know, these cutesy pictures hanging up. They really like them, especially the cat owners. He's not happy. He's not frozen and being still, because let's be honest, most pets don't know how to be still because we don't teach them that. But they're not happy. So when owners are like, he's doing fine, it's hard, especially with FAS3, because we're in that middle zone where it could go either way. We could save it, we could get ahead of it, but the owner thinks he's doing fine. Now, where's your line and what do you say to the owner is going to be really important here. And then a big barrier, a big common thing that you're going to see is clients not returning if they're sent home. And so, again, thinking of your line and when you're going to send those patients home. And then for some safety stuff, we're going to escalate with those triggers that we talked about. They might eat if you're not pressuring them. Again, FAS3s will eat if they're not being pressured. They won't escalate if you can get in there and do gentle handling, touch gradient, keep your hands on them, restrain them properly. Don't let them go around the exam room. Holding their collar is not restraining them at all. If the team isn't trained to recognize body language, that's a big one. If they don't know how to read the pet, they're not going to understand what they're seeing, and we're not going to be able to explain to the client what we're seeing. Again, Kayla can talk more about this, but we challenge their 60 treats per visit. I don't know, Kayla can tell you better how many she might use, but lots of games and entering and exiting the exam room, because some of those patients will bark, try to get you, whatever have you, but if you throw the treats, oftentimes they're going to get the treats.
If you're on a desert island, you have 3 treats.
3 treats?
Only 3 treats you can use for dogs and cats.
Meaty treats.
Yes, moist and meaty, churu, and whipped cream would be my 3. What about you?
What was the first you said?
Moist and meaty, Purina moist and meaty, then McDonald's treats.
See, I do the most meaties, but I also do Red Bar. Those are like the bougie, really nice fruit varieties.
Oh, we can't afford that.
Yeah.
We have those in the party room.
Indian Trail, what do you use? What do you say?
And legal,
Or
right?
nice.
The peanut butter and dogs.
Our
love
man,
it.
legal, sorry.
I mean, peanut butter and it keeps their tongue moving, like, it could be like.
And
you
stuck
just pull
in.
them out and they just.
Yeah.
So it lasts a while.
Yeah. Yep.
But anything else?
We use easy cheese, and then we have like a sweet potato treat that I don't know if the dogs love them. It's like a Rachel Ray sweet potato, and it breaks up into small pieces so easily. You can take one of those and just almost crumble it, and they will vacuum it up. I like the sweet potato treats.
And milk.
Manitoba?
One of my favorites is frozen whipped cream in little cups, and you can top it with a little bit of fresh whipped cream to get them going.
Nice.
So it gets them going, and then there's ice cream in the bottom.
Just have
and that
frozen
keeps them
cups.
going.
Frozen cups.
Frozen cups,
For
yeah,
summer.
we also have frozen,
Like
we do
broth or
frozen
something.
peanut butter and frozen cheese in syringe cases, recyclable
Yeah.
syringe cases.
Do you ever freeze them in ice cream cones? That'd be cool.
We haven't done them in ice cream cones. The whipped cream we do in little reusable cups that we wash. and make sure they're clean, but, those are my favorites.
We do acupuncture, and so we freeze, like baby food cons and, or, cheese or something like that, and that's great for long procedures.
Even frozen lick mats.
Can I ask Michael, what would you recommend?
Oh, liverwurst is like the top one.
Yeah.
It smells really bad, but it works really, really, really well. That's like top. I really like salmon for dogs and cats. And then any like fresh meats. I especially like the Jimmy Dean breakfast sausage crumbles.
I like those too.
Yeah, those are, yeah.
For myself,
For
yeah.
you,
Yeah.
I should get it with their portion. They like it too.
Okay, and then knowing when to use a basket muzzle. Ideally a basket muzzle, not the nylon muzzles. Knowing when to make that call to use it for FS3.
It takes you 15 minutes to make 60 trees on the record.
Takes Kim like 30 seconds. Pre-visit protocols. Again, fear-free has lots of options for you. What has worked well for us is to pick a starting point with choose from there, don't reinvent the wheel, but pick a starting point because it's so much easier. And that doesn't mean we don't personalize it, but it's so much easier to know how they're gonna react to this. This is what we tried, this is what we do, this is where we start. It's great. Of course, we're gonna be open to sedation, but a lot of times for the threes, you can get it locked done on your PVPs. What we do for FAS threes is trazodone and clonidine. Have all of you used clonidine before? I've just started using it. It's an alpha 2, so it's like Stilio, but in a tablet form. For me personally, and I literally mean personally, I tried to give it to my dog, huge barrier to Stilio. It spills, it's hard to give, they don't like it. It's not strong enough in my opinion. I prefer the clonidine tablet, but same idea. It's not overly sedating, but it really relaxes them. And then trazodone for a little bit of that serotonin activity in there as well. If you are interested, if I'm worried about using clonidine and then having to sedate with Domitor, the answer is just no. It's easy just not to worry about it. Unless they are like 3/4 of the way up the stairway to heaven, it's fine. It's in the warning. The easiest thing is just not to worry about it. I know that sounds flip, but I'm actually being completely serious. They have to be very close to death for that to push them over because you can reverse it all with antecedent. If you're like, whoops, that was too much, that's okay, just reverse it.
Whoops.
It's crazy. It's fine. It's fine. We haven't lost one yet. Again, I'm kind of joking, but actually not. It has been going just fine. They are.
Dr. Meg,
yes.
do you give that as tablets or compounded, or how do you give it?
Just the human tablets. You end up having to give them a lot of them, but because they only come in up to 0.3, so you do have to very, very seriously. Sometimes we'll talk about this more with the 4s and 5s. Look a client in the eye and be like, give these 25 tablets 2 hours prior to your appointment. It's not so many when it's just the 2 things for the 3s.
Abraham had to have like 22 total.
Yeah.
tablets.
Big old Great Dane.
Mom said challenge accepted, and it worked.
And it worked. It worked.
For his combo.
It worked.
One note on the pre-visits for FAS3, we have Paul coming in, and he is FAS3, however, he is coming in to visit us because he is in pain, so we actually are doing our FAS5 protocol for him, because what we learned earlier, pain increases their FAS end of that.
When do we sedate them? When we're going to do something that the pet considers invasive, and that's not going to be the same for every pet. If they're coming in for a very straightforward exam, vaccines, blood work, you may not need to sedate at all. If they need an ear cleaning, or for God's sake, if they need a nail trim, then you're probably going to have to sedate them. In fact, we try a nail trim like this. Oh, nope, I reached for his foot and we gave this FAS signal, we're gonna have to sedate. Yeah, nope, we're not doing that today.
Let's try one more time.
Yeah, nope. We already tried and we're not gonna do it.
He said no. He said no.
He said no. He said no. This is when you have to decide where your line is and just stick to it, like Jessica talked about earlier. And it can be different things. Our line may not be the same as Lincoln Heights, may not be the same as Garland, and that's fine as long as your line is always consistent. your clients will self-select what they want. Don't worry about needing them to come back, especially when you see these FAS3s as brand new patients, or we scored them wrong last year, or whatever, and now suddenly they're a 3. Your patients will come back. Your stressed out patients will come back. You're not asking a happy puppy to come back, which by the way, we have done, and they also will. But so that is a different discussion. If you want to talk about puppies, that could be another CE time. And what we've learned in our journey, but they will come back, especially when they are educated and they see how stressed out their pet is, and they are like, okay, the doctor wants me to come back, and then they grudgingly do and they see how well it works. They're gonna be a convert to that for life, and they're gonna tell all their friends, oh my gosh, I can't believe how well Bridget did on her PVPs. Normally she's terrified, and she was walking in the back eating treats and doing great. Don't, once they come back on their PVPs, do not let the fact that it is going well push them too far. Do not do the nail trim. Don't do it. It's a trap. Stop while you're ahead. Stop while you're ahead, please. And is there any leadership team members in the house tonight? I mean, that are from Lake Creek. Your leadership's going to need to back you up. Everyone has to be on the same page, whether that's your hospital manager backing your doctor up, whether that's your doctor backing your assistant up when your assistant says, I don't want to do the nail trim, fine, we're not doing it. You can't then go in there and be like, it's okay, just hold it down. Nope, whatever your line is, that needs to be it, and you all need to back each other up and be on the same page with that.
Can I add one thing? So I've been at this since 2010, so that was October, so 14 years. You'll have people that say, my God, Dr. Blank never did that. Or I've had doctor for 40 years and we've never done that, or I don't give a shit, do it. But they're, no, you have that line and you tell people, we do not, it's not safe, it's not the right thing to do. There are other people in town who do it, you know, they'll do it. But then, like you just said, the people that have that experience will tell so many people. Because what they feel like is they're hurting their pet by trying to help it. So I either haven't gone to the vet or I didn't want to go because that pet is so stressed. We're talking like 4th of July and thunderstorm stress at the same time. And when that goes, like, you do it right, so you're going to lose some people. They're going to be pissed off. But we tend to remember the people that are mad.
We lost one a couple weeks ago.
Yeah.
She's like, what the F is this? Can't you just sit on him? Was her feedback to her nurse when she called.
Is that what you said?
No, I'm not rescheduling. What is this foo-foo crap?
Yeah.
But we've also had potential team members say that to us when we
Yep.
interview them.
Yes. But we've probably gained 5-10 clients for everyone we've lost.
Yeah.
Who love it.
That's exactly right.
Or changed the minds of some of the current ones for everyone we've
But
lost.
sending your clients home or losing them is very, very scary. And I remember when we first started this at Lincoln Heights many years ago, and the thought of like, even me, and I'm like, Fury certified, we got the clinic certified, I'm like, are you sure they have to go home? Are you sure? You don't even have all the spots filled today. I'm like, are you sure they have to go home? Yes. However, not too much, because you send them home 6 times, they're not gonna come back. And then they start to say, now you don't respect our time.
Yep.
But we're trying to do it in the name of Fear Free and make friends visit less stress. If they're a good fit, they'll come back. For us, it is so worth it, and when they leave and they don't come back, we likely did not want them to come back either, or we're going to tell them that when they call to schedule or something. They will come back. But it is scary, especially, that's the 3rd one today. Like, it happens, some days it's none, some days it's a couple. Oftentimes it's, they come back in a week or 2 to do their blood work, because, right, that blood work would have pushed them over. We do that all the time. Or, God forbid, they come back later for the nail trim, which usually is just scheduled for sedation later. We really don't, I know that nobody loves nail trims. We really
It's
don't love
enough
the nail trims.
I think the thing with the nail trims is like, it's not worth the animal being terrified to go to the vet for their physical
Right.
care for the sake
Exactly.
of a nail trim.
Right.
You know?
Yes.
And there are options outside, like, sedation, or you work with trainers that can help get them to that
Exactly.
point, or if you're free groomers, it's just,
Yeah.
it's not worth sacrificing that.
Yep.
Hey, by the way, I have to say something about Mikkel's Fair Freeze, trainer. So, what do you call your title there for the lead trainer, or Fair Freeze had a
Lead trainer.
training? Am I right? So Kel, Tom, we have a canine cocktail named Cutie Pie, who's my heart dog. I frickin' love that dog. But boy, does he not want his feet touched. Like, I'll be sitting there petting him and like, I'm just petting him to be nice. But Kel taught him to trim his own nails on sandpaper with a
Scratch
wedge.
board, yeah.
In 5 minutes. I couldn't frickin' believe it if I hadn't seen it, but there are so many different solutions there. And the one thing is to not take it back to the place where they were always traumatized. And that same thing, okay, I come in the door, I go here, I go through those 2 doors, I go back to the treatment tub, and have my nails trimmed. I thought I was gonna die, 10 times back there, right? Do it someplace different, do it a different day, a different way.
Whereas I'm god awful lazy, so I just sedate my dog who needs his feet touched for his nail
100%,
trim.
100%.
Yeah, he's
You
not
do
Well, I-
smart enough for a scratch board,
When
but.
Kel's not there, that's what you do too. I just go for the drugs, man.
Yeah, he sleeps through it, he wakes up with pedicures, right?
Okay, FAS 4.
FAS 4 and 5, on the inside, in their hearts, have the same levels of stress. They just react differently. So your 4s are your flight, freeze, and pigeons. They do not want to interact at all. They will not take treats, they will not take treats from the owner, they will not play treat games, they will not warm up, no interaction at all, and much more likely than the 3 to escalate to biting. Again, because we're at the same level of fear as a 5, we just haven't gotten there yet. Just wanna make sure.
Okay, barriers for level 5. Our thinking and the client's thinking equals conflict. The client's not on board, let's just try, he's okay. If there's conflict there, again, where's your line? Not enough education to the owners on what the patient is exhibiting. Again, we have those sheets hanging up so that the clients can kind of help understand, so that they can see exactly what their patient is exhibiting in that room. But if we're not educating them, then they don't know that. Patient not coming in with a muzzle on, it is very difficult, as I'm sure everybody knows, to get a patient on, a muzzle on a high stress patient once you guys are in the exam room. Even in the car, it's really hard to get them on. An unwillingness to let the owner restrain and participate is a huge barrier for these patients. And also not willing to have that conversation, or the owner not willing to step out, because again, these patients also are not candidates to go to the back. They don't want to go back, or it is going to cause more stress for them. And then you mentioned a little bit, a lot of these dogs, they are guarding their owners. It's just like, or, we had one of these yesterday, like, same gentleman twice. His anxiety and stress, the owner's anxiety and stress. We had one client, Mr. Benny, he's very, very stressed, and he's on the bench, off the bench, on the bench, off the bench, mom's up and down, up and down, up and down, up and down. It just, we need you to let's just sit still, and let's get Benny settled up on the bench. And then once Benny was able to settle on the bench, and mom sat on the bench, it was good. Benny also is one where as soon as the check-in's done, he has to go back outside and walk around, sniff around, and then come back in for his exam if we can't do it outside. But when he's in the room, it's up and down and very stressed. The other high anxiety one we had the other day was, he was your patient, Elizabeth, and actually Kayla helped too, but like, oh, no, stop. Like, with Bear, he just, they're causing more stress, or somehow think we're hurting them, and it's very stressful for the dog, very, very stressful. So then, I think Kayla got him to calm down, and then they were able to give the sedation, no problem.
How did you get him calmed down?
All I did was let him, so immediately was holding kind of the collar and the muzzle strap because the muzzle was loose on him. And in the past for his vet clinics, you can tell people just lay on him. And so as soon as he realized that I just stood there, he had his little freak out for about 2 seconds, and then he just sat there. And that was it. All I did was hold the collar for him to go through that initial freak out, and then he was good. Great, I'm just gonna hold your head here, brace you against my leg. No problem whatsoever.
You know one thing, the amygdala is that little, amygdala is almond in Latin. It's so tiny, how in the hell I can hold so many negative memories, I don't know. But one of the things to tell people is, a lot of people get a shelter pet and they've gone to a movie halfway through, maybe 2/3 of the way through. They don't know what has happened to that pet. So it's a way of talking to them about not blaming them for the fact that the pet, they may have had a horrible couple experiences that come back to them. Like Cutie Pie, this dog of mine, he runs to the same horse stall every morning because he saw a rabbit there about 10 years ago.
Might still be there.
Every morning
Might
that
still be
rabbit
there.
might be there, but he also remembers the negative stuff as well.
Yeah.
Yeah.
Yeah. When we did our recertification for Fear Free, we did educate them a little bit on what Temple Grandin taught us about our exam rooms being different.
Yeah.
They didn't know that.
Yeah.
But they remembered those rooms. Okay.
Hold on. Temple Grandin, I was with her for 2 days at a practice during COVID, October of 2020. And this pet had a freak out in this room. And she goes, wait, stop. She goes, that dog just took a snapshot of this room. She's thinking like she thinks. Okay, white, smocks, cabinets, wall with a window. She goes, make a note in the emotional medical record. I didn't know she knew what that was, to make sure you don't put that pet back in that same exam room. And we're like, every exam room looks exactly the same. And so that was the thing of making that note. And you said earlier about somebody that has a negative experience with.
Mm-hmm.
Some people are gutsy enough to ask the pet parent, is there somebody in practice your pet prefers to see or not to see? And I tell you, for a lot of practices that have been around forever, it's the tech that's been there 30 or 40 years that is rough, that the pet prefers not to see, so.
And that note on changing that to exam room, we want to ideally make each exam room look a little bit different, so if they do have a bad experience in one,
Yep.
you can have them go to another, and it's not going to look the same or feel the same.
Yep.
We learned that information in the nick of time
Yeah.
to be able to design them differently.
How much
Okay.
difference- Sorry, but as the non-vet, or how much difference does there need to be? Is it just different color? I know dogs are color.
So you really should have different, if anybody in here, if you go to Animal Arts in Boulder, Colorado and do a Google search, say, I want your white paper on fear-free design. It will tell you what paint coats to use. It'll tell you if you're gonna replace your lights, what spectrum LED lights, and it'll have the thing about the differences in the exam room. One thing you don't want are a bunch of pictures in there. I will tell you that. Lifelike pictures of other dogs and cats. Oklahoma State, you had a donor that took all these pictures of all these close-ups of eyes, especially for close-ups.
Right.
So these dogs are going down the hallway with all these damn eyes looking at them. It's like a freak show.
Yeah. Okay, FAS 14 safety. Again, making sure we have the right team member for the situation. Empowering our whole team to help call it. Oftentimes, two team members might be working on a patient. It's that third person that walks by and says, that's enough, we need to stop. But if we're in the exam room and doctor's doing something and the assistant has to try to empower them and help coach them on how to speak up, because it's not easy to do, right? Especially if it's the doctor. But that is going to help a lot. That is going to keep someone from getting hurt. Again, muzzles, 50-50, if you're gonna get it on upon arrival, they need to have that on. We also have used e-collars and blankets. E-collar, can work, so maybe question mark with a blanket over it. And then letting the owners restrain. Here the owner is likely going to help restrain, but they need to go home if you can't get a muzzle or an e-collar on. If it's a day admit, hospitalized patient, maybe the owner can come back and try, but oftentimes the owners also will likely put themselves in a dangerous situation by trying to do that.
I have one comment for the doctors. From a doctor, your only response, no matter who tells you to stop, if it's your kennel assistant that you hired yesterday, it doesn't matter. Your only response should be thank you. If you shut them down, they're never gonna do it again.
Amen.
Thank you, thank you. And if you have to keep going or you have to do something else, please explain to them why.
Yeah, yep.
Okay, once again, pick one protocol to be consistent. Doesn't have to be ours. Look at Fear Free for some other options. Ours is brace yourself. It's on the table. It's on the table. Trazodone, gabapentin, clonidine, and ispromazine. That's a lot. It gets your anxiolytic, and it gets your sedation. You can't use ACE by itself. It's not fear-free, but you can certainly use it with other things to get that extra sedation in there.
Dr. Meg, how many dogs are going to be on ACE promethazine from their veterinarian in the Inland Empire this 4th of July? Way too many.
From me, none.
No, not for you, but way too many vets are still
Yeah.
recommending ACE promethazine by itself. I was on an airplane the other day. It was Atlanta along Jetway. One of those ones where it's weird, where you go this way, and this way, and this way, and this way. I could smell anal glands from when I started on the Jetway.
Nice.
And guess what?
Oh,
The
no.
veterinarian had a little prescription. He just ACE promethazine. The dog's boing, 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 boing.
Yeah. Yeah. But boy, to get them over the edge, to make the anxiolytics work, it's
Mhm.
great. It's great for that.
Yes, ma'am.
Obviously, we're gonna be sedating a lot of these. Sometimes, again, for just an exam or something, and you'll see an example later, for just an exam or maybe a vaccine, you can likely get it done on this amount of PVPs. So when do we sedate them? Do not sedate them to give one vaccine. A needle is a needle. Don't do that. But bundle your procedures together. Okay, well gosh, he needs 3 vaccines and a blood draw and a freaking nail trim. But, you know, he's due for another vaccine in 3 months, let's give that now. And, oh, I was able to look at his teeth and he needs a dental, so do you wanna do that today too? I mean, try to do it once, try to bundle things together. For sedation, when it's time to sedate, I use Domator, again, with clonidine, it's fine. And Torb, because these are reversible. So you can give them a big old dose without being too worried about it, because you can reverse both of those things.
Okay.
Okay, here we go.
Or Jessica, or the years. How do you get the injection?
We're gonna get to that. Oh, don't worry, it's
All
coming.
right, okay.
It's coming, but it's a good question.
Okay.
Again, 4 and 5, feel the same in their hearts. These dogs are fighting. These are your fight dogs. Barking, lunging, muzzle punching. You're not going to escalate, they're already there. They will bite you, 100%. Even on PVPs, even with a muzzle on, they are trying to fight. They are so terrified, it's at maximum. Our PVPs are going to be enough to give 1 injection. That's it.
So
No
the
sedation.
PVPs are the same, the goal is different.
But the goal is different. And when they bite, they may not inhibit it because they are just so maxed out. Whereas a 3 or a 4, when they go to bite you, will probably try to snap, try to muzzle punch. The 5s are just done. They're at max terror level. And we're gonna talk about PVPs more in a minute.
Okay, barriers. PVPs aren't working, but you have to remember what your goal is and set the expectation. The goal is to be able to sedate. Unlike the 4s where the goal is to be able to do some of their stuff. Owner not on board can be a barrier, but very unlikely because, at least in our experience, these owners know, right? How can you really hide it? We need them to participate, but they likely are not going to help restrain. We have an FAS dog where we did a visual exam and then the owner went home and brought us the ear swab cytology. This is the only way we could do it. So from a distance, lots of visual exams happening. No muzzle equals no service, period. We're not trying e-collars, we're not trying blankets. If you don't have a muzzle, you need to just go home and come back, even probably a different day, and get that muzzle on. Not properly communicating with the owners, so you really, really have to be not just confident in how high your drug doses are, but confident in how you communicate this with the owners and how your team communicates this with the owners. The team is going to be nervous. Probably not Kayla, but most of the team is going to be nervous, and then we're all looking for Kayla. And then this is an odd one, but not using enough drugs can be a barrier, but also the barrier that we've run into is the patients are too sleepy at home. And so we try to get ahead of that the best we can. Lots and lots of discussions and warnings about they're going to be sleepy. So be sleepy, but their visit is going to be better.
Here's Jasper. This is a great example of, he's at FAS 5.
We can read this. So Jasper is FAS 2 for check-in. Owner was walking around in the grass while assistant was 10 feet away asking questions. FAS 5 with any touch or approach by the vet staff.
Which we didn't do, we just knew that from the past.
He's on FAS 5 protocol. He entered the practice to the front, although I don't think this visit, he
Not
actually
this
came
visit.
inside. He liked whipped cream, and his trigger is us getting within 5 feet of him. And he prefers to be outside in the grass. For the doctor, FAS 5, by using Jasper's personal protocol, he stayed at about a 2 to 3. Let's see. With PVPs and visual exam from about 5 feet away does not escalate, no barking, lunging. Used Bluetooth stethoscope and hearing aids to listen to his heart from a distance with owner holding stethoscope. Owner gave vaccine with a caveat, we do have owners give something sometimes if anyone's like, oh my gosh, what are you doing? Owner gave vaccines with direct supervision from Dr. Megan. Owner was able to walk Jasper in parking lot to assess gait with no escalation. Jasper ate whipped cream during his visit and during his vaccine.
This was when we met him, barking, lunging, full FAS 5. This is him on his drugs and with the visual exam protocol that we do with mom. She took the muzzle off for him to eat, which we said was fine because we weren't gonna touch him. He's just eating. This looks like any other dog. This, if you had seen him before, it's a night and day difference.
Okay, safety. Have to sedate for hands-on, period, no question. Unless we're doing things from a distance and, owners can help participate in some ways. Muzzle has to be put on at home because all those triggers that Dr. Megan talked about, it's really hard to alleviate those for these patients. So if they don't come with a muzzle, where's your line? We gotta send them home. Confident team members are a must. And if you guys have someone like, gosh, I really think Sally would be good, get Sally some training and get Sally more training and let Sally go through fear-free course and really make Sally be that person that you can go to. Remember where you drew your line and stick to it. We talk about the line a lot because that's gonna be so important. Because owners will try to manipulate you over your line for the nail trim.
Always.
Owners need to be on board, but are not gonna be directly involved in the handling. They're most of the time on board. At least at this point, the ones that we're seeing, they're like, can you please help my dog because I can't take him anywhere, he can't be seen. And so they're on board.
Remember, the drugs are the same, the goal is different. Same drugs, trazodone, acepromazine, gabapentin, clonidine. However, this is just going to give you enough time to sedate. It's gonna just tone down their escalation. Do you have a question, Steve?
Yeah, sorry. Do you have sort of off topic, but do you have a recommended brand for that Bluetooth stethoscope?
Echo.
EKO. And you can do it with headphones so you don't need hearing aids. I'm just kind of joking about it. It's not a joke, I have them, but you can do it with headphones too, with like AirPods or whatever.
It just connects to your stuff.
And then you can even unscrew it from like the part that looks like a snake and the owner can just hold it in their hand. So yeah, you're just trying to tone them down just enough to be able to give them one injection.
We're gonna get into a little bit of a sticky conversation here.
We're gonna get into a little bit of a sticky conversation.
Okay.
Cover baby McKell's as well. You're going to need to cause them a few seconds of stress to save them hours of stress. To save them going home and coming back, going home and coming back, going home and coming back. Okay, I'm gonna try blanket. Oh, he didn't like that. Okay, nope, he didn't like that. Or a higher dose of sedation, a higher dose of the injectable. Oops, that wasn't enough, now he's overridden it, now we have to try again. That's so stressful. There is no way to avoid 5 seconds of stress. I mean, literally 5 seconds. And I think that your drugs, if you're doing Domitor, Torb, and probably ketamine if we're being honest, then you're gonna get a couple of seconds of amnesia and you can capitalize on that. You want to have your most confident team members make a plan in advance. What we do is muzzle on, maybe e-collar, sometimes he can get that on, blanket over the head. We gently get them up against the wall with one person at the head, one person behind, and then one person giving the injection. And you'll see some pictures of things like that. again, you're confident, you're not like, okay, oh, he's struggling, just get in and give it. Then they fall asleep. Their reaction usually is like, what? It's done. If you can get that successful, it is the most minimal amount of stress for the biggest amount of saving them stress. I really, really hope Fear Free still agrees with that, because we have talked to them about it, all joking aside.
Well, you know what, I'm gonna pat you on the back, because remember, it's not just emotional well-being, it's physical well-being. I mean, you got a choice, if you don't do that, and there's, again, the amnesia. Hey, I don't know if this is the right time to mention this, but there's a, you guys know what a VTS is, behavior, VTS and anesthesia, or critical care thing? There's a gal in, is it Bainbridge Island, or where's Monique?
Is it Monique Fairchild? Oh,
Yeah, you know Monique?
Yeah.
So Monique just stays in the room, but she just got bitten really hard a few months ago. What happened? A dog came from another practice, and she walked in the room, the dog lunged and come out the owner's arm and attacked, come through the door. So again, the people coming through that door is a threat. And so somebody not doing low stress handling actually put somebody else at risk.
Yeah.
And it was the first time ever visiting, and just a crazy thing. But again, I think you mentioned earlier, these dogs think they're gonna be harmed or killed.
Yeah.
You know?
And we have, the night that the instruments went in to the bushes,
God, I love that story.
we have tried all of the things you're going to see on YouTube. We're gonna get our line, we're gonna have our drugs in it, we're gonna walk the dog, and we're gonna try to poke the dog while, right? We tried all of those things, none of them have worked yet. Yeah, but, okay, you just walk the dog down the sidewalk, and I'm gonna come behind. None of that has worked for us. Has anyone had that? Did you have it work?
I did.
How'd you do it?
Can you show us how to do it? We cannot get this to work.
But you have to stay low the whole time, and it is tricky, but yes, we did get it to work.
Nice.
Yeah,
Nice.
please send us a video. I'm not joking. We have wanted to get that trick to work.
Tricky, yeah.
We have tried on a couple different occasions, and this just seems to be the best. And in these cases, where owners might not participate, don't let the owner leave your clinic until you know if they're doing day admit or surgery.
Do not
that-
let them leave.
Don't let them leave, because we've called them back many times.
Yep.
Can you please come back? Can you please help us?
We can't even accomplish this. Not everyone, we talk about empowering. Not everyone gets to make this decision, because this can quickly cross the line into, let's just cause 5 seconds of stress. Let's just cause 5 seconds of stress and hold down. Nope, this is a very specific situation with a very specific level of FAS. This is not your FAS 2 or 3 where I just wanna do one more thing, I'm just gonna cause 5 seconds, he won't remember it. No, this is only those who are very, very trained, high level Fear Free can decide to do this and participate in it. Because it has to be very, very fast for it to be as Fear Free as possible. It cannot be, okay, what? So I pin him up against, oh no, he got scared. Okay, let me try again. No, you've already lost. It's too much. It takes too long. You gotta do it quick.
Yep. Okay.
Oh my God, it's the best part!
The end?
No! Cats! Cats!
All right.
I thought we had a 2-drink minimum, or maximum.
You drank mine too.
Oh, and mine,
I
I
had to
think.
get you guys back.
Yeah, that's fair. That's fair. We give Marty a hard time. Cats. We are going to talk about them all at once on purpose for a very specific reason, and it's not because we've already been talking for an hour, and it's not because we don't like cats. I love cats. I'm the cat doc. Love them. They're the best. Again, this is another kind of where you're going to see on many different options on Fear Free for how to treat high FAS cats. The ones we have chosen is once you have that cat in front of you, treat it. Treat it, sedate and treat. Getting cats to the clinic, we all know this, we've all heard this for years. It is a historical barrier to care. The journey in is the worst part. They're trigger stacking the whole way in. They don't like the crate unless we have those very motivated owners, which we'll talk about a little bit later, who have really acclimated them to the crate as their safe space. But even so, they're in the car, they're out of their house, cats are environmentally motivated. It's a lot. Once you get the cat in front of you, it is very demotivating to send them home. We have all owners very open to it. We're gonna sedate today, and next year we'll get you your PVPs if they come without them. Or like with the dogs, the PVPs are to sedate. We have to respect the owners as well, and how hard this is for them, and how much they have effort they have put in to get their cat to you. So while sending them home on different PVPs and levels is in theory an option, in practice for us, this has been the way that we have chosen to do it.
Dr. Meg or Jessica, do either of you have cats?
I have 3 cats.
How the hell do they know you're gonna do something to them? Like, I try to fake them out.
Vibes.
Yeah, they can just sense
Vibes.
that I'm going to get the
Vibes.
carrier.
Cats are very
How do they
vibey.
We're all-
That
know
sounds
shit?
like a joke. I open my eyes in the morning, my cat going to the bed if he's going to the clinic.
I know,
haven't
how the
gone
hell
to
do they
bed.
know that? I was trying to fake them out.
He knows, and they love their crates. It's not the crate, they
Yeah,
just know.
I know.
They know, they're
That is
very,
weird.
very vibey, they can read your mind. My
Yeah.
cats are the best ever, I love it so much. Okay. All right, our FAS 3 cats are our frozen cats. We think, oh, they're not scared, they're being good. The owners are usually slightly more on board, like, oh, he's scared, but it's hard. This is a hard barrier not to push through, even if we know they're terrified, because they're just sitting there. They're unlikely to escalate. They are just, it's just very sad though. When you are used to reading cat body language, it's very sad. They look terrified. FAS 4 to 5, I don't need to tell you how to identify those. We know, the owners know. These are the ones that you guys, not you guys, but people in general are scared of. Like, oh boy. These are the ones that get the bad monikers. These are the cats that are maybe a little bit scary if you're not used to cats. The great thing about cats, one of the many great things about cats, is they are unlikely to actively attack you like that dog Dr. Reddy was just talking about. You walk in the room and the cat mauls you, that is very unlikely. Even the most defensive cats, even the ones who will absolutely attack you, your FAS 5s, when you approach them, if you just walk in the door and they're as far away from you as Jessica is from me, they are not going to come attack you. So it's a little bit easier to make a plan in the moment, which is another reason you don't always need to send them home, you can just sedate them.
Okay, for some barriers, giving medications at home is a barrier for a lot of clients. Churu is gonna be their friend in those cases, or baby food, or yogurt or something yummy. Getting the cat in the carrier and to the clinic, we know is also a big barrier. This was a video that we did, this owner, so in our new building, right, we did all of these fun things for the dogs, and we're like, well, what are we gonna do for the cats? We didn't know. So we told the owners it'd be a great time to buy them a new cat carrier, right? New building, new cat carrier. So this owner took it very, very serious, and she did not buy a sleepy pod, but it's almost like a child carrier, and it kind of works the same. And she spent like 3 minutes just talking to me about how she acclimated those cats to that carrier, because she said we should get her a new carrier and bring them to the bed in it. This cat loves that carrier, and they sit in her office with her, and they sleep in there, yeah. A barrier again is not being able to read body language, not able to handle the cats, no scruffing, it's a big, I think a lot of clinics are probably getting away from that, but I know there's probably just as many clinics that say, how could we possibly do any of this without scruffing the cat? So that's a big, big barrier. And then just having the wrong carrier, the old dusty carrier, the carrier where the lid doesn't come off.
Zip tied
Zip
together.
Hey Val, do you get bit more now that you don't scruff, or back in the old days when you did scruff?
Back in the old days.
100%. I was
100%.
terrified. I was terrified when I came and they were like, no scruffing. And I was like, you don't understand.
Okay.
Hey, what did you say? I didn't understand what you said about the carrier before she said. What did you say? It says,
Oh, zip ties.
oh, right.
Zip ties.
That's
Zip ties,
what-
sorry.
Okay.
Zip ties off.
What is not a barrier for cat owners? Sedation for most owners.
Nope.
Yeah, he bit me on the way in. Cats being too sleepy at home, he sleeps anyways. Asking us to try, nope, he's not okay, please sedate him.
Yep.
Yeah, welding gloves when they come, it's not a good sign.
Right,
Okay.
Yeah.
right. Okay, team safety. So for restraint, we use a lot of towel wraps. We will remove the top of the carrier and cover the cat with a towel. If the cat is going to be striking, we'll lift the top of the carrier up and slide a towel over the cat, or between, and then lift the carrier up or off. If you don't feel like a towel is enough, we've used an old x-ray gown and slide it between the two, because then the cat can't get through that. Soft carrier, hard carrier that comes apart, do not reach in and grab the cat out. You are going to get hurt. We shouldn't dump the cat out. All of those things should be a thing of the past. And will you see them again if they don't have the right carrier? We have FAS for 5 patients for sure that if they don't come in a soft-sided carrier, we can't see them. Because Dr. Megan will sedate them right through the side of the carrier. And if we can't do that, we can't provide the care that they need.
Put the towel over, I saw you saying something. Put the towel over, have your assistant put the towel over and hold them, and then you just go in with it's great.
No aquariums with gas went down.
Oh, we threw our box away a long time ago.
We fill them with water.
But
was
that
joking.
that
Oh, you
actually,
did too.
yeah, yeah.
Yes.
But all joking aside, that's where this came from.
Yeah.
Our box down cats, when I took over, so we're not doing this anymore. What are we gonna do though?
Right.
So that goes right into
Yes,
the next.
so
point.
so one thing that we would encourage everyone to do is, you all are thinking about these high FAS cats, call them now in advance of the appointment that they have coming. Can you get them PVPs? Can you recommend a carrier? Send an email to just cat owners and talk them through some of these things. Again, once you guys decide what exact parts of this you want to implement, reach out to your clients now.
And that was something that did not actually come from a fear-free place originally for me. It came from a not boxing cats down anymore. That was long before I was fear-free certified and before we owned the practice together. It was, I can't box them, I gotta do something.
Yeah, so I'm gonna share my backpack story. So the new fad right now is the backpacks for cats. You see everybody carrying with their little globes and the cat can look out. Today, I had to have a discussion of getting a new carrier because cat came in twice now in this backpack carrier. And he had a horrible experience the first time in it with us. We could not get the cat back into the backpack carrier. It was leaping out, lunging, screaming, and they were trying to shove it back in there. So today, when the cat came back, it is vomited, and it's drooling, and it's panting inside the backpack carrier. And it can't, there's no room. This is a 14-pound cat, and he has nowhere to go. And I said, let's get this cat out of here. And because he had gotten so upset the first visit, we got a spare carrier and we let him come out, and he gladly came out. We gave him his quick little injection, and he leaped into the new carrier, and we zipped it up, and he was on his way. And we talked to the owner, and she understood, and she's like, here, you have the backpack carrier, it's yours. And she was not willing to buy it anymore.
All right, pre-visits. Lots of options. This is the one that works best, we think, is gabapentin, because the capsules are easy to give at home in Churu. If that's not an option, switching to the liquid for certain patients has helped compliance. Especially the marshmallow flavor seems to hide it the best, in my opinion, not that I've tasted it, but it's fine. There is a new, pregabalin itself is not new, but there's this Vaughn cat product that is pregabalin that I have not used yet, but there are reported to be some benefits to pregabalin, like a smaller amount, it's more potent. Look into that, that's probably gonna be the next thing that we're going to explore.
And they're really advertising it towards a stress-free ride to the clinic is sort of their tag that they're using.
Yeah. Sedation, say it with me, high doses. If you leave DKT, domotortor ketamine, domotortor for the 3s if you need to sedate them for something. In the 4 and 5s, if you leave the K out, you will miss it. We've gone through that. Luckily with domotortor, you can usually at least give the ketamine, unlike in some of the dogs, but you're gonna waste 25 minutes with that. Just give it on the outset. Just do it. If you wanna do it, do it. Wake them up in their carrier, especially the 4s and 5s, but sometimes your 3s are gonna escalate when they wake up somewhere that they don't recognize. We have learned that the hard way when we've had a very terrified cat who woke up escalating to a 5 in one of our kennels. Unlike dogs, do not let the owner come back and get the cat out of the kennel. That's a great option for dogs. We've talked about owner restraint, owner helping. It's different for cats because of what we talked about earlier. They're motivated so much by their environment that even when mom comes back, they're like, I don't even recognize you. You're a pod person, we're all in danger. They will lash out. It's just not the same thing. They're not like, oh my God, thank God there's my mom. They're like, I don't even know what's happening right now. So have them in their kennel when they wake up. And if you don't, we've all been there, don't have the owner do it. They will get hurt. Get your favorite cat wrangler and have them towel them out and put them in their kennel.
Hey, what do you think, in every practice thing has a cat wrangler? I mean, what makes a cat wrangler? I mean, I guess.
Our whole cat team is here. Stand up, you guys.
That's okay.
Confidence!
Stand up, Marty.
Well, what do you think it is?
Confidence.
Confidence.
Yeah.
Nothing scared.
Yeah.
And vibes. You
Yeah.
have to just be on their level. And that sounds like so hokey and not something that you can learn, but it is something you can learn. You
Or not learn.
Or not learn and have someone else learn it.
Or not.
Yeah, or not.
Or not.
I don't know, like boy, Elizabeth would walk right up to a FAS 5 dog, but one time she came to me and said, oh, this cat, I don't know, he's really like a FAS 4 to 5, and I was like, really? I see him every year and he's been fine, but you know, who knows, right? Trigger stacking, who knows? I went in there, the cat walked up with his tail up, and I was like, oh my gosh, hi Fluffy. I picked him up, he went, "Broop," and we're snuggling. Elizabeth was like, are you kidding me? We don't like you.
Okay,
Okay, we're getting there. Hang in there, everybody.
so a few more slides with some videos on them.
Yeah, these are fun. There's only like 15 to 18 more slides. That's a joke.
So this is what it looks like in Easy Vet, and these are the demeanors, and we use the demeanors really for lots of things, but, and then it refers over to, we also have a section where we put more in-depth notes.
So this is an FAS 4 on his pre-visits. You can see the owner's got the head with the blanket. We start up where the owner's hands are. I'm reminding her, please scratch, yep, give him some of those camera sensations. Then I'm kind of scratching and pinching with my left hand. Vaccine, he did not even move.
What you don't see is he is also eating whipped cream.
Oh, I'm gonna wake it. And then this is after. This is again. Don't look him in the eyes. Do not get down on his level. This is where the owners helped us out by giving us some tips, because we would want to normally sit down. Allow him to approach first. He loved treats. He was playing the treat game happily. And then here's what we did, which you just saw there, and covered up his head. He's eating. He was fine.
And again, every patient is different. You do see that he doesn't have a muzzle on, so when we say all FAS 4s need to have a muzzle on, it's
There's
not
an
always.
exception.
Like it's just every patient is different.
This is This is where you straddle him and come up from behind, because this is our FAS 4 with a muzzle on, because he will escalate. He came in muzzle trained. Mom had already done that. She's got him, instead of facing her, because he will whip around, she gets him in the middle position. He won't eat right at that moment, but he stays, you can see he's stressed, but relatively calm compared to what he was. She's scratching him, she's petting him. I came up awkwardly from like her leg and then slid my hand back. You can't have a personal bubble in Fear Free. I just warned them what I'm gonna do and gave him, I'm listening to his heart there, gave him his vaccines, no escalation. He stayed at about a 3, which for him is pretty good. This is Indy, he's an FAS 5, however, he de-escalates to a 4 on his PVPs and we can do his exam. So again, this is some personalization. He turns out that he de-escalates enough with his PVPs that he becomes a 4. That's rare, usually your 5's right, you're sedating them, and I don't really touch him very much. Mom and Dad are showing me his teeth here. He's asleep. You can't tell, but he is out.
And these new drug protocols we're using are new to us. So, in another 6 months, our 5s have to be sedated is going to be evolving, especially if they come in like that.
Can I ask you a question? Like some of these ones you've shown, were they, did they hear about you from somebody else, or were they just happened to live in the area?
This patient grew with us. He was here before we were Fear Free, but some of them are.
Yeah.
Oh, absolutely.
Yeah.
Mm-hmm.
And
Yes.
here I'm coming up from behind again. I do love to do that. And Mom was petting him, and I just slipped that vaccine in. These are just pictures. This is Charlie. We wrote an FAS email that Jessica somehow magically gets out to all of the?
So all of
Explain
our
that.
FAS, I think 4s and 5s, because they're color coded by appointment type in EasyVet. So EasyVet said, I can say, okay, send an email to all of our high FAS patients, because we tell, the owners know, you're likely gonna have a visual exam, send us pictures. So this is Dad. Dad sent us pictures. We got videos of him walking. But turns out this was Charlie when Charlie came in. Our PVPs worked really, really well.
And that's a calming cat because Charlie is very visually stimulated.
Explain what that is.
That is basically like horse blinders. Charlie has a muzzle on as well. So muzzle, that's why the calming cap isn't quite as far over his head as it usually could be, but it covers up their eyes and it just reduces the visual
It's kind of a
stimuli.
fly mask too.
Yeah, yeah, like a fly mask. That's what I was thinking,
Yeah.
right? But, and he does great. I mean, again, a visual exam from a distance, but we were able to listen to him, which was basically our one goal that day. Listen to him, give his vaccine, because all of the rest of it was pictures, eyes, where was videos, like Jessica said, of him walking to assess his gait. I mean, the owner did a really great job. They're taking these emails very seriously. They're bringing pictures.
Can I tell you something that's coming? There's a way to take that information, there's a new thing called Pet Portal AI that takes a lot of those pictures, plus stuff you do in the clinic, and there's an emoji of the pet, and the pet talks to their mom or dad about health issues. Which I think is, so that stuff is not just like, right, it's not body condition scoring, lameness examinations.
We would literally love nothing more than to help you.
So you can email us. Fear Free also was kind enough to give a discount for anyone who would like to get Fear Free certified. There's the code. We can also email that stuff out tomorrow when we email some other stuff out.